Hello, my dear friends. Welcome to the class on Tourette syndrome treatment. So, Tourette syndrome is characterized by chronic multiple tics. So, you should need to understand what is tics. So, tics is a sudden, coordinated, abnormal movements which is repetitively in nature, which is particularly seen on face and head, especially in the children. So, tics are more common in the children and there is a suppression of voluntary movements for a short period of time. So in common tics there will be repetitive sniffing or shoulder shrugging. So what is the pathology behind this Tourette syndrome? There will be disturbance in the basal ganglia. So you need to give antipsychotic drugs. So thereby it suppresses the tics in patients with Tourette syndrome. How? By reducing the D2 neurotransmission in the basal ganglia. So coming to the aripiprazole. Aripiprazole is a atypical antipsychotic drug. So remember that it is the only antipsychotic drug which has been approved by FDA for the treatment of Tourette disorder. So it is a first line agent for the treatment of Tourette syndrome. You will be starting at doses of 2 mg per day and you can increase to a maximum of 10 mg per day for those whose body weight is less than 50 kg, or you can increase to a maximum of 20 mg per day if the body weight is 50 kg and more. So most of you will be asking the question why haloperidol or pimozide is not preferred in the treatment of Tourette syndrome. So these are the very important points you should keep in mind. Previously, that is previously, the low dose high potency typical antipsychotic agents like haloperidol and pimozide were the treatment of choice. The reason for not preferring these drugs nowadays is in case of non-psychotic patients. Usually the Tourette syndrome patients will be non-psychotic. They will be having behavioral problems. Non-psychotic patients. These are extremely sensitive to the impact of dopamine blockade. So if you give this haloperidol and pimozide in a children who is not having any psychotic symptoms, so in such patients they'll be extremely sensitive to the impact of dopamine blockade, especially on the cognitive processing speed and on the reward center. So these will be affected in the children. That's why you will avoid giving haloperidol. And also this pimozide, apart from this, it also prolongs the QTC interval and increases the risk of ventricular arrhythmias, cardiovascular risk. So haloperidol, the main adverse effect will be the extrapyramidal movement disorder. Apart from that, it also causes sedation, dryness of the mouth, blurred vision, gastrointestinal disturbances. So coming to the one more group of drug which can be used for the initial treatment of Tourette syndrome, that is alpha-2 adrenergic agonist. So these are preferred as an initial treatment. The reason for choosing for the initial treatment is alpha adrenergic agonists are less likely to cause extrapyramidal side effects when compared to the neuroleptic agents. So example are clonidine. So it is alpha-2 agonist. It reduces the motor as well as the vocal tics in 50% of the children. So the mechanism what they suggest is this clonidine is going to reduce the activity in noradrenergic neurons, that is in the locus coeruleus. So what are the adverse effects when you give clonidine? There will be initial transient fall in the blood pressure, most common adverse effects associated with fluoridine is sedation. Apart from that, it can also reduce or increase the salivation and it can cause diarrhea. So there is one more drug under alpha adrenergic agonist, that is guanfacine. It can also be used as a part of initial treatment for Tourette syndrome. So these two drugs are particularly helpful for behavioral symptoms, so which involves impulse control disorders. So under atypical antipsychotics, you can use aripiprazole as well as risperidone, but aripiprazole is a preferred drug as well as it is the only drug which is been approved by FDA for the treatment of Tourette syndrome. We can also use risperidone, but the problem is at lower doses it produces lower symptoms of extrapyramidal motor side effects, and at higher doses, if the dose is increased, it will cause more extrapyramidal motor side effects as well as it can lead to hypotension. So these side effects are not seen with the aripiprazole. So and also these atypical antipsychotic can be used in a patient who are having significant behavioral problems. So what are the other treatment or the drugs which have been tried and used in the treatment of Tourette syndrome? They are clonazepam, carbamazepine. The injection of botulinum toxin A has been tried, and also they have tried deep brain stimulation. Thank you.